Gum disease and prevention of gum disease is the big issue nowadays. We know from some quite recent research that the inflammatory reaction caused by gum disease can cause problems with the rest of our bodies. Heart disease, possibly Alzheimer's disease, there are various things that we have to be extra careful about. And because we have an increasingly aging population, these things are starting to show up more and more. It's very important from an early age that we try to work out who is genetically predisposed to gum disease and then make sure we target some prevention throughout the course of their lives to make sure that they don't end up developing serious periodontal disease. Because not only does that mean we'll have all the dental things to consider, we also know it will have an impact on the rest of their bodies. The initial symptom that people will notice is they'll spit blood when they brush their teeth. And that's the first sign, is that there's an inflammatory reaction happening. It varies greatly. Some people find out quite late in the process. Some people, when they first present to us with bleeding gums, already have suffered quite a lot of damage below the gum line. Well, initially it's very straightforward. We have to identify that there is a problem. We have to make sure people know how to control the plaque that grows in their mouths every day and empower them essentially to make their mouth a habitat not suitable for the kind of bacteria that cause the problems. Once tartar's developed, especially when tartar's developed below the gum line, and tartar is just plaque that's been there for such a long time that it's calcified and baked onto the teeth, if you like, we have to physically remove that. So the patients come along to see the hygienists, have thorough cleanings, and then we will gauge how they respond and how they improve based on that cleaning. Some patients will come and be seen, if they have a significant predisposition, will be seen every 3 months. A lot of patients are seen every 6 months to keep things under control, and some patients who aren't particularly genetically predisposed will be seen once a year. When we've identified that the patient has a predisposition, it's very important that we as dentists structure the prevention program. We don't just let these things happen. The hygienist has to be involved. The hygienist will give feedback to the dentist about how things are going with the treatment. And essentially, the patient has to find a hygienist that they can get on with. This person is there to help them with fairly significant issues and prevent these problems that can be a major disability to some people. So your hygienist really needs to be your best friend.